What I'm going to do now is demonstrate the use of 3/30 seconds CuraDrape in application of a Volar wrist cock-up orthosis, a custom fabricated, custom fit job. And so this is a great material for new splinters, no orthotic fabricators. And so what it does is it allows good drapeability and good setup time, but still some rigidity within the material that gives you some confidence in its application. So I'm going to set this in a hydroculator. And then I'm going to get ready to position my patient for success, where I want to be able to position them in order to have the best outcome and application for this orthosis. So let's say we're doing a pre-op carpal tunnel syndrome. We'll kind of keep them in a wrist neutral position. We'll get the thumb in an IP extension here, an MCP extension, just to give nice opposition with the index finger. And what I'm going to do is I'm going to do the thumb hole cutout. One of the most important things with this orthosis is to make sure that the thumb hole cutout has enough space so it doesn't push on the basal joint dorsally of the thumb, but it also doesn't put pressure on the dorsal first compartment of the radial aspect of the wrist. So that's one of the biggest things we have to watch out for, that material is rolled back enough, but also doesn't sacrifice stability. So let's check our material now to see if we're ready to go. I think we are. Again, as always, what I'm going to do is go ahead and touch the material to the patient. Does that feel? How's that feel? Okay. I'm going to open that thumb hole up and roll those edges already. So I don't have to do that on my patient. So now I've gone ahead and started with a step already. I'm going to place that on our patient. Roll those edges, and just apply that with a nice, gentle stretch and support to the arches of the hand. So in whatever position we want. Now, again, we have a nice thenar crease here. We're not putting pressure on the base of the CMC joint dorsally, and we're just below the MCP crease that allows good MCP flexion. Okay, that's one of the most important things, that this doesn't go above the distal palmar crease and block MCP flexion. So we're going to allow that to set up here. And again, all we're doing is we're allowing gravity to take that drape down a little bit. I'm not pulling, I'm just giving some support, making sure to support and conform to all the arches along the hypothenar eminence, the palmar creases, okay, and the radial aspect of the wrist. And then at the end, what we could do, come down here, if it's too long, is trim or flare those edges out. So we should be ready here. Just a couple more seconds of application. And again, this is used for multiple conditions. Again, you could use it for generalized wrist pain. You could use it as a differential diagnosis for other conditions, ganglion cysts, carpal tunnel, distal radius fractures, multiple things as we go along. And one of the important things is to make sure that the orthosis does what the patient wants it to do, and we educate them about its use and function. So now we'll go ahead, and how does that feel on you so far? Can you touch your thumb and index together for me? Good, okay. Can you make a fist gently? Open your hand back up. Now we're going to lift that off. And now what we've done here is gone ahead and we have that to conform custom right to the patient's curves and arches. So now at that point we can go ahead and reassess that orthosis, take a look if there are any pressure areas on there, then place our straps dorsally, radially, and ulnarly, and across the proximal aspect of the wrist. Okay. Once we're done with that, educate the patient about what it's used for and how it's going to meet his goals, and you've made an orthosis.